Welcome back. Thanks for being here. Pookaduke Reacts. Got a great video here for you guys. It's ER Nurse, Igor. Let's get it started.
Get outside to the ambulance bay and all I see is this blue car, older model, and it is just riddled with bullets. The windows are all shot out. I'm like, oh, like shit, this is like legit. Rule one of emergency medicine is you take a quick pause and you look around, make sure it's safe for you to approach the situation. So quick pause, look around, I see one kid standing outside of the car on his phone. And I'm like, okay, he's covered in blood, but he's standing, he's talking, not priority right now. I look in the back seat, I see a very animated, what looks like a female, and someone that's not moving. So I'm like, bingo, that's my priority. Swing the car door open, and all I see is a kid hunched over, his girlfriend or whoever is freaking out, and he has, it's called agonal respirations, which is, it's end of death breathing. It sounds like basically the body trying to get any air into its vital organs. And then I'm like, oh, okay, not good. I pull out my pen light to assess, see if there's any glass so I don't hurt myself. And all I see is brain matter, just all over the car. And I'm just like, oh, fuck.
These folks see the crazy
All right,
things.
Igor.
I don't know
Good
how
morning.
to do it.
Igor, you are, what do you call your profession? What do you do?
I'm an emergency department nurse.
Emergency department nurse.
Yes, sir.
And you work on one of the downtown,
I do. I work downtown Los Angeles, down the street from MacArthur Park.
oh, well, you're right in the heart of it.
The heart of it. It's an interesting clientele that we get all day and all night in the emergency department.
What kind of people are coming in?
Everyone. So I live, of course, if you're familiar with Los Angeles, right? You have Koreatown right there. You have Chinatown. You have East Hollywood. You have Hollywood. You have, unfortunately, the homeless population of that area.
Damn,
and so
in
we
LA?
get all of them, sometimes all at once.
I'm sure you've seen people that are on my channel in your,
Maybe.
in your emergency room.
Unfortunately, can't disclose that, but maybe I have.
I'm certain you have.
Right.
What made you want to get into this field?
You know, they asked that question in nursing school orientation. This was COVID times, pandemic, so Zoom, and the director asked that same question, why do you want to be a nurse? And going around the boxes of, everyone's giving these amazing stories of, my mom was in the hospital, and the nurses were amazing and to get care of her, or I was in the hospital, or my significant other, whatever. And then as they're saying all this, I'm like, do I lie in this moment to sound like I fit in with this group of my future colleagues, or do I say the truth? And I was like, you know what, don't lie, because when you lie, it always comes back to you. And it's my turn to speak, and I said, I just thought I'd be good at it. And that was the true, honest answer, because I was a lifeguard before that. I've been in medical emergencies. I've always performed well in them. Mm-hmm. And when I switched from psychology to nursing, I was like, okay, what am I good at? Chest compressions. Who does chest compressions? Nurses. Let's be a nurse. And that was a segue into nursing.
Good for you.
No.
How old are you?
33.
33.
Yeah.
And you're from Russia?
Ukraine, Odessa.
Ukraine?
Yeah.
Oh, okay.
Been here since 2000.
Yeah, people don't name their sons Igor.
No, usually not. I've only met one other one, and he was from Brazil.
Oh, okay.
So, yeah.
So you, like what is the majority of the people you'll see? Like addiction stories or?
It's, honestly, it's everyone. It's addiction, it's of course overdoses and drug use, it's heart failure, it's strokes, it's heart attacks. It's in the emergency department, we are the jacks of all trades. I'm expected to know how to respond to every emergency that walks in through that door. And that's your pediatrics, your neonatals, your labor and delivery, like your mothers that are coming in pregnant, giving birth. It's your heart attacks, strokes, your overdoses. I'm expected to know how to respond to all of that. And there's no such thing as a common night. It's from 5 minutes to 10 minutes to 15 minutes, we'll see an overdose, someone who's in cardiac arrest, and someone who's checked in because they ate too many hot wings. And so it's just complete controlled chaos all night.
How does this job affect your personal life?
It's made me more calm. It's we're on shift for 12 hours at a time, 3 nights a week. And so outside of work, I've calmed down a lot. I've noticed that like in traffic, someone cuts me off. In the past, I'm like, you know, motherfucker. Now it's just, they have bigger problems to worry about. The rest of my life is calm, relaxed, no stress. But it's also made me reevaluate friendships and relationships. I'm around a lot of death, and so are my colleagues. And in their last moments, no one's asking for to see their bank account, to see their trophies, to see their accolades. They're all calling out for family, for friends. They want to see pictures of their loved ones. And so that's made me think, like, yes, it's great to have things, but relationships is what kind of drives us forward.
Yeah, absolutely it does.
Yeah, it's just changed my whole perspective on life and how life is short. I'm heading to the gym after we're done here.
Mm-hmm.
I can drive off onto Main Street and get into a car accident and pass away in 2 hours.
Yeah.
And that's just made me, if I want to do something, I just do it. Obviously, as long as it's safe and only affects me. But I just live my life the way I want to live it and not the way someone says I should.
Yeah. Yeah. When it hits you, it hits hard,
Yeah.
especially when it hits close to home.
Yeah, and it's just being around that with me and my colleagues. We just all tight knit together, and then when we're outside of work, they all have families and kids, etc. But it's all very family. Let's spend time together. How are you? It's time off social media. It's all
Sounds like
very
he doesn't
in
have
the
kids
moment
or-
living.
What do you think of the fentanyl epidemic?
Oh, it's horrible. It is absolutely horrible.
Because before fentanyl,
That's probably so easy to him. He's like, he sees it, but he knows that that's probably like the least of his worries.
heroin, you could overdose and die, but it was rare.
Yes.
But with fentanyl, it's so common.
It's cheap, and it gets you high. And most of the overdoses that we see is fentanyl. There's classes of overdoses that we see in the emergency department. We have those who were found, let's say, MacArthur Park, I'll use an example. Someone called 911, firefighters showed up, and they gave them a medication called Narcan, also known as naloxone. It's in the field, they use it as a nasal spray. We have IV. Patients already awake, alert by the time they get to the hospital, and usually they either just jump off the medic gurney and walk out, or they get violent and aggressive towards us because someone just killed their high, and then they end up leaving. Or option is they're still very groggy, and we monitor them for a few hours, make sure that they don't fall back into an overdose, and then they are discharged back to wherever they live. And of course, option number 3 is they come in and they've overdosed and they've been down for too long, and now we're doing CPR and giving them life-saving medications, hopefully shocking them with a defibrillator, and that's kind of the worst case scenario, is when they end up in the ICU or they don't make it.
And as I learned painfully last week, they're putting fentanyl in all kinds of drugs.
Yes, so in the emergency department, for some reason, it's always things come in clusters. If we see one stroke, we're gonna see 3 more. If we see one cardiac arrest, we're gonna see 3 more. I don't know, it's like the medical gods, I don't understand it. We had one night when people that were dressed nice were coming in as overdoses. And I mean that in the most respectful way. Usually our overdoses are the homeless population, and they're not dressed nice, but we were getting women in dresses, we were getting men in tuxedos, all testing positive for fentanyl and cocaine. And they were out partying, and what they thought they were doing was cocaine, party drug, as we all know, mixed with fentanyl, and they were just all overdosing. And when they would wake up, they're like, hey, I did cocaine tonight. Last thing I remember is being at this party, having fun, and now I'm here. I don't know what happened. And they're like, hey, you tested positive for fentanyl. And so they're just shocked to learn this. And it's just amazing that they're using multiple drugs and selling it as one thing, and now people are dying from it.
Yeah.
And about a month ago, 3 weeks ago, we had a string of overdoses, just nonstop. And usually, for the fire department, they spread the love. They'll send a few patients to this hospital, this hospital, this hospital. And we later found out that I don't know how the drug world works, but the manufacturer had different dosages, different syringes of different product. And whoever was at the local park, and they had 8 different syringes, labeled 8 different ways, and they were just coming up to people. And injecting them at the park, and then sitting back and watching. Who reacted how? Did this person passed away? This person's really high. This person is freaking out. This person's high. And they were marking down notes of how these different dosages were affecting the people. And the only reason we found that out was the police told us. Like, hey, be prepared because we're sending you a bunch of overdoses tonight. And on this people, like the Narcan was working, on these it wasn't, so we didn't even know what was in it. It was, some of them were being PCP, fentanyl, cocaine, others was just, it was just a mess.
Just using homeless people as
guinea pigs.
As guinea pigs.
And this job has showed me how inhumane people can be and how life to someone else, your life doesn't matter.
I can't imagine being a drug dealer, like mixing that shit up and putting that in there. Like, I don't get how, are they just thinking money? Are they fucked up on it too? Like, I don't get how they do that.
And the people that we were able to resuscitate, they would wake up and say, hey, I do drugs, but I didn't do any today. I don't know why I'm here. And then we examine and there's a pin mark on their neck or their arm or somewhere. Horrible. And it's just, these dealers just don't care. And with this, and fentanyl especially, it's just non-stop. All night we get the overdoses, and all day. And every hospital in America probably.
And it's probably in other drugs, like even weed, they could probably put it in?
Sometimes. We see, sometimes it's rare, because with weed, it seems like since it's legal now, like here in California, most get it from dispensaries.
Yeah.
So it doesn't seem to be
But when
mixed.
you're buying it on the street.
Yeah, but the homeless population, they'll get it mixed with other things.
Yeah.
Yeah. I used to smoke weed. I used it for sleep reasons, and then I became a nurse, and that's no longer allowed. But I would get it from the dispensary, and I was never concerned. But I can imagine from the street that you should be paranoid that it's being mixed with something else.
Yeah. But with drugs like cocaine, it's always coming from the street.
Yeah, you can't buy medical grade cocaine, unfortunately.
No.
And and I know we were talking before we started, and it's just very unfortunate. And this epidemic of drug use it has the hospital at its knees, because we're now focused on things that are preventable versus things that are not, like heart attacks and strokes. And we just get these horrible overdoses that most that survive just wake up and...
Dang, I didn't even think about that. Think about how much workforce and hours are put towards, like, fighting everyday things instead of, like, preventative medicine. They're fighting overdoses, gunshot, violence, all this other stuff. He could be working and studying on other stuff. Surreal's crazy.
start swinging on us because we just killed our high. Yeah.
I'm sure you have some interesting stories.
Yeah, I mean, I was just in court for an assault case a couple of months ago. A gentleman came in, high as a kite. He started swinging at us. And as my colleague Jim and I were trying to hold him down until security gets there, he spit at us. And that's an assault. And as of January 1st, this new district attorney made it that any assault on a healthcare worker is a felony. And so police came, took him away, and we had court, spent the morning in court and the judge basically ruled that he's now going to go to jail because it's not his first time, and he's no longer allowed to come to the hospital where I work at unless he's unconscious in an ambulance. And that's the good story. We won.
And it probably also gets him clean for a couple months.
Yeah, he has mandatory rehab, mandatory anger management. But all these assault cases are not like this. I have a colleague now, he's been out for 3 months now because he was standing at the door doing his job. Person's coming up, he says, "What are you here for, sir?" And this homeless individual shoulder checked him. And my colleague's had a torn pec now for 3 months, has been on medical leave, has to have surgery next week. And we have cases like this almost every night. I was bit a little while ago by a patient, had to check.
Yeah. You're bitten.
I was, and it was kind of my fault because that's why I'm a nurse and not a professional fighter. My hand should not have been next to his face, but he punched a security officer. And he didn't know that I was behind him, so I brought him to the floor. And in the scuffle, he bit my wrist. And I was like, cool, now I have to check in, antibiotics, tetanus shot, the whole nine. And this is, we've all been kicked, punched, scratched, bitten, spit on. One case was a patient was discharged on a day shift, I'm night shift. They had an emesis bag, which is like what you throw up in. and they waited for the day shift nurses to leave, and they threw it at them. And like 5 of the day shift nurses got covered in vomit. And disgusting.
That is disgusting.
Yeah. But yeah, these assault cases are pretty common in healthcare, unfortunately.
There's got to be some sad cases too.
Yeah, there was a nurse in Florida a few months ago. I believe it was Florida. She got her face completely fractured by one of these patients. I mean, he beat her up, and she ended up in critical condition in the ICU, I believe. And of course, they caught him and they put him in jail. But this nurse, she's done being
Do they not have security back there?
a nurse. Her face is mangled, unfortunately, and she was now probably going to be having PTSD for the rest of her life because this male attacked this female nurse and just completely shattered her face.
Yeah, the combination of drugs and mental illness
Yes.
is just so out of control.
And it's different me talking about this because I'm a bigger human. And
You're 6'6".
6'6", I weigh 250 pounds. Me talking about assault, everyone's like, your name is Igor, like you're gonna be fine. Versus one of my colleagues who's 5'2", weighs 100 pounds wet, and I work with some of the baddest women I've ever worked with, but me taking a punch and her taking a punch is 2 very different situations. And that's why it's...
You think he gets pussy chat? You think he'd be fucking the nurses? I don't think so.
always something's going on until security gets there. Igor, I'm like, all right, on my way, because I can at least, my stature deters most situations, but when they're hopped up on who knows what, they don't care. And PCP is making a resurgence. And as a man, if you've ever wanted to be humbled, try to tussle with someone who's high on PCP. Like, you think you're strong? No, these men are just, 6 of us are holding them down on the bed and they are still bucking us.
Yeah.
We're just like, oh my God, please get the restraints.
Yeah, Corey, who drives around with me on Skid Row, he's my little helper down there. Mm-hmm. He and I will see people on the street or see crazy things happening, and we just, first thing we say out of our mouth, that's PCP, or that's crystal meth, or that's, you can just look at a person now and know what their drug is.
Yeah, and it's
sometimes it's just mental illness.
Yeah, and that's the hard line right there, because perfect example, if I get a patient who are high on something, but they're also showing signs of mental illness, now we have to dance this fine line of like, okay, do we treat them for they're high and that's why they are behaving the way they're behaving, and we let them metabolize and sober up and then send them to a psychiatric facility, which never happens, because once they sober up, they always leave. Because
they're free to leave.
They're free to leave. Like, you are not forced to stay at the hospital. The second you want to leave, you can stand up and walk away. We are not a closed door psychiatric facility. And even if you're in our psychiatric unit, if you stand up and you are alert, you can tell me your name, you can tell me the year, and at least maybe like the president, you can leave. And I will not chemically or physically restrain you. But if you stand up and you are gibberish talking and you're not able to walk properly, then unfortunately we do have to chemically or physically restrain you until you're able to give us some basic answers about yourself or about the world. And most people don't seek that, don't stay long enough to get the mental health benefits. They stay long enough to get the medical benefits, but not transferred out to all these centers that we have contracts with to get them the proper medication that they need.
Okay.
Because we get it frequent where they say, like, I'm on, let's say, Seroquel. When's the last time you took it? It's been months. That's not good. And then by the time it's trying to transfer out, they're gone. They just run away.
Is there anything you think that the city or the country, the state, or whatever could do better about this whole situation?
Just regarding like mental illness and drugs?
Yeah.
I mean, yeah.
It seems to be growing and getting worse.
It's getting exponentially worse. When I speak to nurses that have been nurses for 10, 20 years, they say it was not like this before. But also where I work, it's not the best in regards to that. But I think that early recognition, because when in nursing school, so my background is psychology. I wanted to be a sports psychologist, but then I decided I didn't like it anymore, so that's why I switched to nursing. Mm-hmm. I have a good foundation of what does bipolar look like? What does schizophrenia? What is all these different disorders, what they might present as? Where in nursing school, you cover it for 10 weeks, and that's it. So it's early recognition would be my number one as kind of government-funded. Let's train our triage nurses on early recognition of, is this drugs or is this a person who's about to have a psychotic break? That would be my biggest kind of thing that I would want to see. Because it's oftentimes, it's like, oh, they're just high. I'm like, no, they're not just high. Like, she is clearly manic and she's bipolar. Like, we need to watch her versus like, oh, here's some medications, like discharge back to the street, which just happens often.
Therapy should be mandatory for all of us.
Yeah, I mean,
all of us, like everyone from the top of society on down.
Yeah, I agree. And I mean, especially in my field, I think that we should all be offered complimentary therapy.
For sure.
For sure.
Yeah.
Because, yeah, like there are things that we see on a daily that I think are normal now, where if I tell these stories, people are looking at me horrified. They're just like, are you okay? I'm like, yeah, why? Oh, yeah, I guess you don't see that often.
What's the most gruesome thing you've seen?
Oh, man, there's so many. I can share a recent one.
Sure.
It was a few months ago. Typical night in the ER, which means it's not a typical night because it's the ER. And my assignment that night was resource nurse, which is you just, as it sounds, you resource the unit, you help whoever needs help. Security runs in. They're like, hey, I think we have a homeboy drop-off in the ambulance bay. And a homeboy drop-off is typically gang members don't want to check in and give their name because they're gang members. And what they do is they have a injured, I don't know, friend.
Homie.
Mm-hmm. They just kick them out of the car, whether they're stabbed, beat up, shot. They just kick them out of the car into the ambulance bay. And then we run out and we grab them and do our thing. Homie drop-off, right? Makes sense. And security runs in, like, hey, we think we have a homie drop-off, et cetera. So I'm free. I don't have an assignment, so I can just go. I get outside to the ambulance bay, and all I see is this blue car, older model, and it is just riddled with bullets. The windows are all shot out. I'm like, oh, like shit, this is like legit. Rule 1 of emergency medicine is you take a quick pause and you look around, make sure it's safe for you to approach the situation. So quick pause, look around. I see one kid standing outside of the car on his phone. And I'm like, okay, he's covered in blood, but he's standing, he's talking. Not priority right now. I look in the back seat, I see a very animated, what looks like a female, and someone that's not moving. So I'm like, bingo, that's my priority. Swing the car door open, and all I see is a kid hunched over, his girlfriend or whoever is freaking out. And it's called agonal respirations, which is, it's end of death breathing. It sounds like basically the body trying to get any air into its vital organs. And then I'm like, oh, okay, not good. I pull out my pen light to assess, see if there's any glass so I don't hurt myself. And all I see is brain matter just all over the car. And I'm just like, oh, fuck. I grab the kid. At this point, my colleagues have a gurney coming. I place this kid on the gurney. And then I'm like, okay, go. And then now my attention's on this other kid. And I look at him once again, get my pen light, shine it, covered in just blood. And I'm like, hey man, are you shot? Are you hurt? And then he's like, oh, I don't know. And then I look at him closer and he has bullet holes. He's wearing like a long sleeve black sweater and he just has bullet holes all over his sweater. And I'm just like, oh no. And then he's pale as a ghost. He faints. Luckily, I scoop him up, and I can't yell out gurney.
Do you think he's white, black?
Because they just brought it. So I just carry him to inside the emergency department, put him on the bed, and any trauma, we strip off the clothes, etc. At this point, the initial kid that I pulled out of the car, he's now intubated. Fluids are running. My colleagues are trying to stabilize him with one of the doctors, Dr. Villacorta, amazing physician. Luckily, he was there that night. Charge nurse is on the phone with a level 1 trauma hospital because we are not saying, like, you have a patient coming in. And I'm like, hey, well, you have 2 patients now coming in. Now we have 2 ambulances en route to us to take these people to this trauma center. Luckily, the patient I was working with, he was only shot in the shoulder and arm multiple times. Few inches, it was his left arm. So a few more inches to the right, he would have been his heart, but he got very lucky. I stabilized him, gave him pain medicine, gave him like anti-nausea medicine, gave him some fluids, he was fine. The other kid, we didn't find out until later. Unfortunately, he did not make it. And
that was the brain.
Yeah, and so the reason that story stands out to me the most is we see gunshot wounds all the time. We see all of this occurring, all this gang violence occurring all the time. 20 minutes later, I'm standing around at the nurse's station. We're all debriefing a little bit, and I wear this jacket at work, and I have inside pockets. On the right side, I always have a trauma tourniquet and IV start supplies, and the left side is always like gum, snacks, because we never know when we're gonna eat. And so I'm like, I want a piece of gum. I like to chew gum. And so I reach into my pocket, and I feel something squishy, and I pull it out, and I'm holding a piece of this kid's brain in my hand, about that big.
Why was it in your pocket?
When I pulled him out, it must have fallen in.
It fell in your pocket.
Yeah. And I'm just like, how is this my job? Like, how is this what I do for a living? Because now I'm like, what do I do with this? Like, I put a biohazard bag, send it off to lab, it's now evidence. But yeah, that's like one of the many stories that.
Are you an adrenaline junkie?
0%.
No.
No, I've never been skydiving. I don't drive fast. I get enough of it at work now.
Yeah.
Yeah, it's good. It's like seeing your reaction right now to that story is like why I'm like, yeah, this is why I don't really talk about it often.
Right.
Because I told that story at a dinner party, like a dinner with a few friends of mine, and they were bitching about their jobs. They're not in healthcare. They're like, Igor, we never hear about you. Because I always say everything's fine. When they're like, oh, how's work? My initial reaction is everything's fine. Move on, because no one needs to hear about this.
About the brain in your pocket.
Yeah, no one needs to hear. No one needs to know this. And so they're like, no, like we want to know. Like we haven't seen you in a while. Like what? How's work? So I tell this story, less graphic, because we're at dinner, we're like finishing up dinner, and I look up, and they're horrified. Like my friend and my other friend, they're just horrified, and my friend's girlfriend's like on the verge of tears. And I'm like, no, guys, like this is fine. Like this is not even the one that haunts me. Like this is all good. So yeah.
Amongst your nurses and doctors and the paramedics and the cops and detectives and all this, I've seen this before, and I do it because I'm seeing so much like terrible stuff. I'm hearing so many terrible stories. There's a tendency to laugh about it rather than just sit there and cry, because the alternative to laughing about it
is therapy.
Is getting therapy and crying. Mm-hmm. But it's a protective measure.
It's a defense mechanism, 100%. All of us have a very dark.
And sometimes people will be horrified that I laughed at something that someone's telling me, but I'm just. Otherwise, you got to stop the interview and start crying.
Right, and we all have a very dark sense of humor. I'll give another story right now, and it's not funny. It's not, but it is. You know, we had a patient come in. There's a phone that sits at the nurse's station that's connected directly to 911, to the fire department. And that's the phone that they call and say, hey, we're 5 minutes out, we have this and that coming in, so that we can prepare ourselves. Phone rings, answer it. We're doing compressions on this patient found down at the restaurant. Bystanders say that he choked. Standard. We bring him in. He's on it's called a Lucas machine. It does automatic compressions. We take that off because it's the firefighters. We can't use it. We start doing compressions, et cetera. Doctor's trying to intubate. Can't. He sees there's a hot dog, like half of a hot dog, just sitting in the throat. Forceps pulls it out, intubates. Unfortunately, he was down for too long. Like we didn't save this patient, but we find out later that he was a widow. His wife passed away 3 years prior, and it was his first date off of a dating app. He was finally ready to date again, and it was his first date.
No way.
Of the last 3 years. And
this motherfucker choked on a hot
without
dog
skipping a
on the
beat,
first date.
my charge nurse, who's been an ER nurse for 10 years, trauma one, just around all of this stuff all the time. He just goes, well, his wife just said, nope, you're coming up with me. And it's not funny. It's not. But in that moment, that's what we, the staff, needed because of this horrific event that we just went through. Seeing a hot dog pulled out, not saving this patient, everyone's sad and just mulling over what we could have done different. And this charge nurse, he says, the wife's like, nope, you're coming up here with me. You're not dating anyone. And we're all just, it's not funny.
But you laugh.
But we laugh because we have to. Because if we can't go home.
The job would be just too traumatic.
Yeah. Yeah.
If you didn't have that ability to see humor in it.
Yeah, and it's sometimes it comes off wrong to the patients that can hear us. Of course, the nurse's station's not in a soundproof bubble, and sometimes because these people just watched what we did over here. And now we're all, joking with each other, and now we're all smiling and laughing.
It's a way to stay professional as well.
Yeah, and they think we're being insensitive to the patient, but we're just like, but we're not. Like
you're seeing so much of it that it becomes a great.
Pretty sure I saw this in real life. Like, they're so used to seeing that shit. I was in the hospital, and, like, you had them and cutting up, cracking up, and joking at the nurse's station. Then you got, like, somebody dying over there. They're just so numb to it, just like any of us with, like, a job. Like, it's important for us to, like, remember, that this is important for them. Just because we've seen it so much doesn't mean it's any less important to them. The worst thing that's happened to you is the worst thing that's happened to you.
Tool.
But it's hard.
Yeah.
To cope.
Absolutely. Absolutely. It's, it's not there are still days when I'm driving home and I'm like, how is this what I do? Like, how is this my job? And then there are days when you're leaving work and you feel like a badass because you just saved three lives. You did some cool things. You put an IV in someone's neck and then you drilled another IV in someone's foot. And it's like, yeah, I feel good. And then other days I'm leaving, I'm just like, what the fuck was that?
It's got to be hard when you lose somebody.
You get so used to it and then it hits you all at once. But like the ones that are imprinted in my brain as like my trauma that's stored back in my head aren't ones that we've lost. It's ones that either have a really messed up situation, because there's worse things than death. It's when we keep someone alive past any meaningful life. And those are the cases where I'm just very saddened by, because we see it often with older patients when they're very ill, very sick. And there's something, it's advanced directives. And it's your choice. You and me can make this today with a lawyer or our doctor. And it's, how do I want to be saved? If I have a heart attack right now, do I want to have compressions done on me? Do I want to be intubated? Do I want life-saving medications? Or do I want you to just make me comfortable and let me pass? And what we see often with older, like 90s, 95, 99-year-olds, is that their family just can't let go yet, and they make them full code, which means that you do everything that Western medicine has to offer to save their life. And me doing chest compressions on a 99-year-old little grandma and giving her all these life-saving medications like epinephrine, and we're giving her magnesium and all of these things. Like, yes, she technically is alive right now because she has a heartbeat and a blood pressure, but we also just gave her more epinephrine than anyone should ever have in their body at once. And we know that she is probably going to pass away in the ICU tomorrow, in an hour, whenever. And to us, it almost feels like torture at times, because we know that they're not going to survive, but we have to, by law, do everything that we can so that they do survive, at least while they're in the hospital. And that's hard.
Chat, what are y'all doing
Those are
in that
hard.
situation?
Yeah.
Let me ask you something about fentanyl. This is for my own personal
Please.
reasons, but it'll be interesting for the audience, I think. When somebody dies of a fentanyl OD, it's a peaceful death, right? They're not like they're not going through pain. They're not horrified. They're not going through some horrific OD.
So with fentanyl causes something called respiratory depression, and normally we breathe 18, 16 to 20 breaths per minute. That's normal standard. With a fentanyl overdose, your body just starts breathing less and less times per minute until it stops. It's not painful. It's
a peaceful way to go.
It's a peaceful way to go.
Yeah.
And the hardest part is when we get them back. And now they're going to have that pain of the chest compressions, et cetera, et cetera. But if it's just a standard overdose for the fentanyl, it's usually pretty peaceful.
How long is it before they're gone? Like you can bring them back after some period of time. Like I found my girlfriend in a cold bathtub, hard, blue lips, stiff.
Okay.
There's no bringing that person back.
No, it's stiff as a rigor mortis. It's once the body is stiff.
I found my roommate one time. He was blue. He was still breathing just a little bit, very faint, but I was slapping.
Unfortunately, there's nothing we can do from a medical standpoint. But with like the fentanyl overdoses, if it's happened within the last 20, 15 minutes, there's a chance. We've done codes for 5 hours. Before codes, meaning like we're doing compressions and giving medications, et cetera. We've done them for 5 hours, 6 hours on an overdose before because the patient's younger, and we've gotten them back.
You have.
But what kind of a life did we get them back to? Because they've been brain dead for
damage.
6 hours, 5 hours.
So there's brain damage.
Most likely brain damage. And are they alive because we have so many drugs in their body right now? Or are they alive because we performed a miracle and now their heart's going to function on their own? And most likely not. It's the drugs that are in their system. And with most of these patients that we work on for a long time, once they get up to the ICU, they typically don't last much longer. But straight overdose, it's peaceful. They don't know. There's no anguish in that moment. They just slip away.
Yeah. I'm surprised, and I don't want to
In a fucked up way, I'm kind of happy about that. Those people go through so much pain, or they feel so much pain, and that one moment, they can just go off in their sleep. I feel like that's like, there's rare moments where that's gonna happen, and in life, the like death is gonna be that peaceful or that just painless. Maybe you can like euthanize people.
Give anyone any ideas, but it seems like fentanyl is such a dangerous thing, substance, that it could be sprinkled on a place where people are eating food or touching doorknobs or doing all kinds of
My biggest fear is when we get an overdose patient who is now stable, we place them to the behavioral side of the hospital, into the unit, and we have to take off all of their clothes to make sure that they don't have any more drugs or weapons on them. Even though they get wanded by security, we still need to double check. My biggest fear is that when I'm taking off someone's clothing, I get a puff of powder or whatever onto my face. And even though I'm wearing a mask, it can go through my eyes, skin.
You're still breathing.
Yeah. And there was that video a few years ago when the police officer.
If that does happen, they got Narcan in the hospital. They know what it is. It's going to happen. And I don't think it really reacts that quick. Like, I think he'll feel it. But, like, I don't think he's going to die or overdose that quick.
He was going through a patient's suspect's things. And you see it on video, something touches him, and he goes into a seizure. And it turned out to be fentanyl. And that's my biggest fear at work, is that I get accidentally hit with some kind of substance, and it turns out to be fentanyl, and I die. Luckily, I'm in the emergency department, and hopefully my colleagues saved my life.
Yeah.
But that's still one of my biggest fears, is just getting hit with something and having an overdose, or now there's fentanyl in my system, or whatever, cocaine. Biggest fear.
Okay. Let me ask you one last question, Igor.
Drug test come around, say, yo, I swear to God, there must have been some fucking fentanyl in one of the sheets or one of the pockets, or there's coke in there. Oxy fell and rolled in my mouth.
What would you say is the most important thing you've learned through doing this kind of work?
Man, the most important thing is just to cherish your relationships and your friendships, because like I mentioned earlier, you don't know what your day is going to look like. Like I said earlier, I can die right now, leaving this space. I can pass away. And it's like in my life, I like my mother, my grandmother. So ever since I became a nurse, it's always like, I call my grandmother every day. I call my mother every day that I can. I have a half brother. I talk to my brother whenever I can. He's 19, he doesn't want to talk to me. But I talk to him whenever I can. And it's just to cherish those around you, because at any moment they could be gone. The most kind of pain that we feel in this profession is when we are actively trying to save someone's life and their family members watching. And it's normal for the family to watch us attempt to resuscitate. And the worst noise that's imprinted in my brain is the sound of a mother finding out that her son has passed away. And that shriek, that scream, it is the most horrible thing I have ever heard in person, and I will remember that noise for the rest of my life. And it's her, to this day I remember this, it's the doctor came out and spoke to her, and he walked her to the bed where the body was, and he told her that we did everything we could, and we just couldn't save her son. And just horrible. And it's just cherish your loved ones, cherish your friends. That's the biggest thing I've learned from this job.
It's great.
Yeah.
Igor, thank you very much.
No, thank you for having me. It's
super interesting talk.
It's been an experience for sure, man. Like seeing this on YouTube, Instagram, and then being here today, it's like, oh my God. Well, I never thought I
That was a great interview. Thanks for tuning in, guys. I'll see you guys on the next video.